New parenthood can be a stressful and anxious time, and it's common to worry about accidents happening. Each year, 40,000 under 5s are taken to hospital after an accident, and lots of these are preventable. This is why we're here to offer advice and support to reduce the risks and give you and your family greater peace of mind. Some of the most common accidents include choking, suffocation, and strangulation. Since babies and toddlers are unable to remove what's obstructing their breathing on their own. To reduce the risk of choking, ensure small objects such as buttons, toy parts, batteries and coins are kept well away from your baby's reach. And if you're feeding with a bottle, ensure you keep a hold of the bottle and your baby. Don't use pillows or duvets with babies under the age of 1. They'll suffocate if their face gets covered as they're too young to be able to push it away themselves. And keep nappy bags and plastic bags out of your baby's sight and reach and away from their cot to avoid them pulling the bag over their nose and mouth. If you carry your baby in a sling, be sure to hold them tight to your body, keep them in view, close enough to kiss, and keep their chin off their chest with a supported back. To reduce the risk of strangulation, don't tie a dummy to your baby's clothes, as the tie or ribbon could get caught and close around their neck. Be sure not to leave any ropes or cords such as those attached to clothing or items like curtain ties or cables lying around. And if your home has banisters more than 6.5 centimetres wide, you'll need to cover them with boards or safety netting, since small babies are able to fit their body but not their head through and may become stuck. Cot bumpers are a suffocation and strangulation risk, so be sure to avoid using these. In the early days of their lives, babies learn how to wriggle and kick, and some can roll onto their side, which means they can easily slip or roll off of beds, changing tables and sofas. East Sussex sees some of the highest numbers of injuries related to falls in under 5s in England, which is why we're working alongside families to reduce the risk. Be sure to stay with your baby when they're on a high surface such as a bed, sofa or changing table. Never leave them unattended. You could try changing your baby's nappy on the floor rather than a table to reduce the risk of them falling during changing altogether. Make sure you keep any walkways or stairs free from toys or clutter to avoid you tripping when carrying your baby. It's not recommended to put babies in walkers or standing bouncers. And don't put chairs or car seats on tables or work surfaces. When your baby moves, the seat will move and they could slip off. And always strap your baby in when you secure them in a car seat, high chair or pram. Microwaves don't heat milk evenly and you can get hot spots. Test the droplets on your arm. They should feel lukewarm rather than hot. Since the baby's skin burns more easily than an adult's, at bath time run the cold water and then add the hot after, and always check it with your elbow before putting your baby in. Thermometers can be unreliable, so we don't recommend them. A baby can drown in as little as 5 centimetres of water, so be sure to always stay with them when they're in the bath. Drowning is one of the most common causes of death in babies and small children. Because it's often silent, you won't hear them struggle. Even if you're using a bath seat, always stay with your baby, since bath seats aren't designed to be used as a safety device. And empty the bath as soon as you take your baby or toddler out. Caring for a pet can support young children to develop their communication skills, kindness and empathy, but it's important that children are aware of how to stay safe around pets, especially dogs. Dogs can find it difficult to understand children's behaviour, and they may feel threatened by close facial contact, loud or sudden noises, or fast movements. Always stay with your children around dogs and teach your child not to approach dogs when they are eating or having a treat, playing with a toy, sleeping or unwell. Show your child how to play gently with their dog, teach their dog tricks and give them space if they need it, and ensure your child doesn't approach a dog they don't know. For more information about keeping your child safe, you can visit the websites of the Royal Society for the Prevention of Accidents, And to find out if you qualify for extra help and support from the East Sussex Fire and Rescue Services Child Home Safety Advice and Equipment Service, visit their website. You may be eligible to receive specialist advice and safety equipment installed in your home. And remember, our friendly health visiting service is always on hand to discuss any worries or concerns you may have about keeping your baby safe.